everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in our previous session, as we have discussed about body temperature, we've also discussed about the factors that affect the body temperature, right? So in today's session, we are going to discuss about the assessment of the body temperature, how we can assess and what is the importance of assessing the body temperature. In today's session, I'm also going to teach you the various nurses' responsibilities while she is assessing the body temperature of the client. Okay, so here, as we all know, that the body temperature is defined as the balance between the heat which is produced in the body as well as the heat which is lost from the body, right? And also, as the body temperature is an indicator of the normal body functioning, so it is very important that we must assess the body temperature. And not only that, the nurse, assess the temperature of the client in order to get a baseline data as well as to detect if there is presence of any abnormalities. So what are the various nurses' roles in assessing the body temperature of the client? Here, the first role of a nurse is the selection of the site. So here in our previous session, as I have told you that there are 4 sites through which we can assess the temperature of an individual, right? That is the oral, the axillary, the tympanic, as well as the rectum, right? So here, the first thing as a nurse, before you assess the temperature of the individual, you should make sure that you select which site you will be assessing the temperature from. And then the second one is the frequency of monitoring, which means how often will you be assessing the body temperature. And the next is to detect the client who needs more frequent monitoring, right? So here, as I've told you, that each and every client, we need to assess their vital signs, right? But here, after you've just, first assess, if you find that there's any client whose temperature is higher than the normal level, then you have to detect those particular clients so that you can make sure that you assess their body temperature more oftenly. And also, as a nurse, you must ensure the accuracy of right technique of monitoring the body temperature. And the last role of a nurse is documenting and reporting. So here, as I've told you, that documenting and reporting is an essential part of the nurse's role. Whenever you had assessed the condition of the client, whenever you find that there is any abnormalities, or whenever you find that there is any progress in the client condition, you must always document and report it to the other healthcare team members who is involved in providing care to this particular client. So those are few of the nurse's role that she will be doing while she is assessing the body temperature of the client. Now moving on to the next, here we will be discussing about the points which the nurse needs to remember while she is selecting the site for assessing the body temperature. So the first thing that the nurse must keep in mind while she is selecting the site for assessing the body temperature of the client is the vicinity of the major arteries. That is why, because here the arterial temperature gives an accurate reading of the total body temperature. That is why before you select this site for assessing the body temperature, you need to check the vicinity of the major artery. And the second point is that before you select the site for assessing this body temperature, you should make sure that in this site there should be absence of inflammation. Why? Because if there is presence of inflammation, that area will be warmer than the other body parts, and this can give you an inaccurate reading. Okay, and as a nurse, you should also know the accurate reading which is required by each and every client. Why? Because here it also depends on the condition of the client, right? So here, for example, if the client is being admitted into the hospital so that a certain surgery can be conducted, then it becomes very essential that the accurate temperature monitoring should be done, rather than for a client who is admitted with a condition such as scurvy. So here, what I basically mean to say is that when we are assessing the temperature of the client, or when we are selecting the condition of the client, we must make sure what is the accurate reading of that particular client which is required by them. Here, for example, if the client is admitted because he needs to undergo a surgery, right? So here, before they undergo a surgery, it is very important condition that we must get an accurate reading of their body temperature. However, if it is just for a minor condition, in case if the client is admitted with a condition such as scurvy, okay, so here, yes, I will not say that you should not have an accurate reading. Whenever you are assessing, you should always have an accurate reading for each and every client. But sometimes depending on the condition that the client is in, more priority is given to that client. We also have to see the consciousness level of the client. So here, as I've told you, that we can assess the temperature orally, right, through the rectum, through the axillary, or even through the tympanic. So here, in case if the client is unconscious, okay, so we cannot assess their body temperature orally. Why? Because he will not be able to open his mouth and all, right? So here, if the client is unconscious, then the best site through which we can assess the body temperature is through the axillary, right? So here, depending on the consciousness of the client, then we can also, make a decision on which side should we opt for in order to assess the body temperature. The next one is the factors such as eating, or if that particular client is having the habit of smoking or even of drinking. And the last point that we must keep in mind before we select the site for assessing the body temperature is the age of the client. So here, for example, if you need to assess the temperature of a child who is below 6 years of age, then it is highly suggested that it must not be done orally. Why? Because here, if you place a thermometer on the mouth of the child, then he may bite it or even he may break it, and this could lead to various other complications. So if it is for children, it is highly preferable to assess their body temperature through the axillary method. So here, depending on the age of the client, we can also assess the body temperature through different sites. So as I've said, that there are 4 sites through which we can assess the body temperature of the client. The first one is through the oral method, right? So here, this oral method is the most convenient as well as the accessible one. The second is the rectal, which is the most accurate and the most reliable one. The third is the axillary, which is the most safe and non-invasive one. And the fourth one is the tympanic membrane. So let us look at each uses of these sites through which we can assess the body temperature. So the first one, that is through the oral method, right? So where will you place this oral thermometer? You will be placing this oral thermometer in the sublingual area of the mouth, that is beneath the tongue, okay? So what is the use of assessing the body temperature through orally? So here, if you assess the body temperature orally, then it is very easy for you to place a thermometer. And not only that, if you assess the temperature orally, then you will also be getting an accurate as well as a consistent reading. However, this site of assessing the body temperature is contraindicated in cases of unconsciousness, in children, in clients who are not cooperative with the procedure, in clients who have undergone any oral surgery or who is suffering through any oral infections, in clients who have the habit of smoking, of drinking, and also in a disoriented client. Moving on to the second one, that is the rectum, right? So here, when you are assessing the body temperature of the client through the rectum, then you must make sure that you place the thermometer half an inch in the infant, whereas 1.5 inch in the adults, okay? And you must place this thermometer through the anus. So what is the use of assessing the body temperature through the rectum? The first use is that it is safe to assess the body temperature for client who is having comatose. It is also safe for assessing the temperature of the infant, child, and also for a disoriented client. However, when you are choosing this site for assessing the body temperature, then you must also keep in mind that this site gives a higher reading than the oral route. That is why before you assess the body temperature, before you select the site, you must make sure that it is clear in your mind what are the normal values of the temperature which you will be assessing through various sites. But there is a certain disadvantage when you want to assess the temperature of the client through the rectum. Why? Because here when you assess their body temperature through the rectum, then the client may not feel socially as well as psychologically comfortable. And also, if there is presence of impacted stool, anal fissure, hemorrhoids, or if the client had undergone any rectal surgery, then assessing the body temperature through the rectum will not be a good option. And then the third one is the axilla. So when you are assessing the body temperature of the client through the axilla, then you will be placing the thermometer under the arm. This is usually used in infants and in children, and also this site is mainly choose in case if the oral or the rectal site is contraindicated. And then the next site is through the tympanic, right? So you will be placing the thermometer into the tympanic membrane in order to get the body temperature of the client. So these are the various sites through which you can assess the body temperature of the client. Okay, so for assessing the body temperature, you need an instrument, right? So this instrument which is used for assessing the body temperature is known as a thermometer, and you will also find that there are a variety of thermometers which will be available in the market. But among all of these, the most commonly used thermometer is the glass mercury thermometer. And this glass mercury thermometer, as you can see in the picture, has two parts, that is the bulb as well as the stem. So here the bulb is the very fragile part and is also very sensitive to the temperature. And the stem is a hollow inner tube which will consist of the mercury that will expand or contract with the variation in the temperature. So the marking is done from 94 to 110 degree Fahrenheit or 34 to 43 degrees Celsius. So here any thermometer can be used in any site, but you must make sure that the thermometer which you are using for assessing the rectal temperature must not be used for assessing the oral temperature. So with the use of this thermometer, you will be able to assess the body temperature of the client through any site. However, when it comes to a thermometer which you will be using for assessing the temperature through the rectum, then you will be finding that there will be a presence of the red dot on the tip which will be opposite to the bulb. So as I've said that this glass mercury thermometer consists of the mercury inside it, right? Which will then consist of the stem and the bulb which will be made up of glass. So that is why this can be broken very easily. And if this glass mercury thermometer is broken inside the mouth, then there are a certain complications that can occur. It can lead to mercury poisoning in case if the mercury has been ingested, or it can also lead to tissue injury that has occurred from this glass mercury. And one thing you must keep in mind is that in order to minimize the microorganism, you must make sure that you clean the thermometer before as well as after the body temperature has been assessed. So as I've always said that the normal body temperature is 98.6 degree Fahrenheit or 37 degrees Celsius, right? So what is this Celsius and Fahrenheit? It is a unit which is used in order to measure the heat. So this body temperature can be recorded in both Celsius or in Fahrenheit. However, if you need to convert this Celsius into Fahrenheit or this Fahrenheit into Celsius, then the following formula can be used. If you need to convert from Fahrenheit to Celsius, then you can use this formula, that is 5 by 9 degree Fahrenheit minus 32. Whereas if you need to convert from Celsius to Fahrenheit, then you can use this formula, that is F, which is equal to 9.5 degrees Celsius plus 32. So here I have given you one example. Suppose if you need to convert 50 degrees Celsius to degree Fahrenheit, then what you can do is that you can use that formula whereby you will be using the F, which is equal to 9 by 5 degrees Celsius plus 32, and then where this degree Celsius is there, you will be putting this 50 degree there, and then you will be getting the calculation of it. So now moving on to the signs and symptoms of altered temperature. So if there is an alteration in the body temperature, then what are the various signs and symptoms you can see? The first one is dry, pale, and diaphoretic skin. You will also see that the client will be having a rapid and a shallow breath. He will be having malaise, tachycardia, as well as complaints of thrush, shivering, chills, as well as goose flesh. So if the client is having an alteration in the temperature, then these are few of the signs and symptoms you can see. And after you have witnessed that the client is having these signs and symptoms, then only you will be getting an idea that, okay, maybe there is an abnormalities in the temperature, and then you can start collecting the data so that you will be able to select the site in order to monitor their body temperature. What are the nursing diagnoses which you can formulate if you find that the client is having a variation in the body temperature? In case if you find that a client is having increase in body temperature because of the presence of an open wound, then you can state it as hypothermia related to open wound. In case if the client had undergone any cardiac surgery and after this has been performed, you have encountered that the client's body temperature is below the normal level, then you can state it as hypothermia related to cardiac surgery. And in case if you find that the temperature is fluctuating, then you can state it as ineffective thermoregulation related to any procedure or any condition that the client is suffering from. And in case if the client health status reflects that there is presence of risk of developing a fever, then you can state it as potential alteration in body temperature related to whatever condition that the client is suffering from. So depending on the condition of the client, or depending on the medications which they are taking, or depending on the procedures which have been done for them, in case if you have found out that before or after this particular treatment or this particular procedure had been provided and that their body temperature had increased, then you can state the nursing diagnosis accordingly. Now moving on to the advantages of assessing the body temperature through the oral method. The first advantage is that since I've said that while you're assessing the temperature through the oral method, you have to place a thermometer in the sublingual area, right? And since we know that this sublingual area is the area where there is a good supply of blood, right? So through this, we will be able to get the accurate temperature. And also, if you are assessing the temperature through this method, then there are very less chances for the bulb to come in contact with the air. And also the thermometer can be held easily in the tongue, and also no privacy is needed for this particular procedure to be performed. However, there are certain disadvantages as well. If the nurse does not know the correct location or how to place the thermometer, then this can serve as a disadvantage. And instead of keeping the thermometer in the sublingual area, that is under the tongue, if she keeps it just in the mouth, in the oral cavity, then there is a possibility of recording the false temperature. There is also a high chances for the thermometer to break in case if it is given to the children or even to a client who is disoriented. If the thermometer is not disinfected properly, then it can also lead to cross infection. And also, if you are disinfecting the thermometer and if you do not do it properly, then the client will be getting the bad taste of the disinfectant. And also, if the thermometer is kept for quite a long period of time in the mouth, then the client may be feeling discomfortable. Then in which condition is this oral method contraindicated? It is contraindicated in patients who are extremely nervous, delirious, unconscious, hysterical, and mentally confused, as well as for those patients who does not follow the instruction. It is also contraindicated in patients who's having convulsions or who are breathing through their mouth. And not only that, it is also contraindicated in patients who have injuries, who have inflammation, or who have recently undergone any oral surgery, or even for people who is suffering from cough, and for children who are below 6 years of age. What is the advantages of assessing the temperature through the axillary method? It causes less discomfort to the client. It can be used for children as well as for any other clients who are not able to hold the thermometer under their tongue. As well as if the client is taking any hot or cold drink, then this will not affect the temperature. As well as there is no chances of cross-infection or breaking of the thermometer if we assess it through the axillary method. However, along with the advantages, there are certain disadvantages as well. As well as if the bulb goes beyond the axilla while we are assessing the body temperature, then it can come in contact with the air and give a false reading. Now moving on to the next, that is the advantage of assessing the temperature through the rectal method. This is the most reliable method. Why? Because here the rectum has a good supply of the blood vessels and is also not influenced by the external air. And also, if the thermometer is positioned properly while we are assessing the temperature, then it will be fully surrounded by the tissues and we will be able to get an accurate reading. What are the disadvantages? While we are assessing the temperature through the rectum, then it requires the privacy of the client. There are also high chances of the nurse's hands to get soiled. And also, if the rectum is loaded with fecal matter, then it can also give us a false reading. So, for whom is this site of assessing the body temperature contraindicated? This site is contraindicated in patients who have recently undergone any rectal surgery or who is having an inflamed rectum, and it is also contraindicated in clients who is suffering from diarrhea. So these are the few advantages and disadvantages as well as contraindications of assessing the body temperature through the rectum. So now we have come to the end of this topic. So in today's session, we have discussed about the assessment of the body temperature. We've discussed about the body temperature. We've discussed about the nurse's role of assessing the body temperature, as well as the certain points that the nurse must keep in mind before she selects the sites of assessing the body temperature. And since we know that there are 4 sites of assessing the body temperature, we've also discussed about the thermometer, which can be used for assessing the body temperature. I have also taught you about how to convert the Celsius and the Fahrenheit scale, and at the end, we've also discussed about the certain advantages, disadvantages, as well as contraindications of the oral, rectal, as well as the axillary method of assessing the body temperature. So I hope by now you've got a clear understanding of this topic. I'll be meeting you guys in another session whereby I will be dealing with the alterations in the body temperature. In that session, we will be seeing about what are the various conditions that this increase or decrease in the body temperature can lead to. So until then, have a good day. Thank you.